So as Wisconsin looks to establish a new youth correctional system, it's incumbent on us to act with great urgency to respond to the immediate crisis that Lincoln Hills and Poplar Lake schools. We must take deliberate action to promote youth justice system reforms that are most effective, safe, sustainable, and that support proper care and treatment of our youth. To that end, Act 185 aims to establish a regional model of state and county facilities, and I emphasize the word here, facilities, that will replace large juvenile correctional facilities. While Act 185 has many merits, it doesn't go far enough. It only marginally improves the status quo when a paradigm shift is needed. Instead of pushing for transformational change, it aims to improve conditions of confinement without reducing the number of youth Wisconsin places in locked custody or in aiming for the governor's goal of reducing the state's carceral footprint. To be sure, we will face significant challenges in the upcoming biennial budget. As you have heard today, or will hear today, the cost to establish a statewide county-run network of secure residential care centers for children and youth, according to the current parameters outlined within DOC 347, will exceed $100 million. Additionally, the cost to establish 2 Type 1 facilities and expansion of services within the Mendota Juvenile Treatment Center will also likely exceed the current proposed allocation. You have also heard, or will hear, the reluctance of counties to assume responsibility for a failed state system without the resources to effectively improve it. The current parameters of Act 185 and DOC 347 predispose all SRCCY proposals toward costly new construction or renovation of detention facilities, without adequately examining the risks and needs of our confined youth or best practices locally and from other jurisdictions to minimize unnecessary confinement and rehabilitate youth in the community. This creates a situation where policy and fiscal realities are at odds with each other and provides the committee with the impossible task of knitting together a statewide system that will be heavily focused on new bricks and mortar and will fail to make the policy and cultural shifts necessary to rehabilitate Wisconsin's youth or advance public safety. Change management author and entrepreneur Peter Drucker said famously that culture eats policy for breakfast. Type 1 facilities are prisons, and they will inevitably come with a prison culture. If we replace failing prisons with new prisons, we will ultimately end up at some point in the future with new failed prisons. Wisconsin is poised to follow the lead of other states in closing all youth prisons and replacing them with safe, secure therapeutic programs that are much more effective at reducing crime. Before we get into detail about our proposed solutions, I'd like to review briefly our proposal as it relates to the current requirements under Act 185 and DOC 347. In response to the March 31st, 2019 deadline, Milwaukee County submitted a 49-page proposal and 18 supporting documents outlining facility design, projected census, project and operational costs, descriptions of programming, and so on. And the costs necessary to effectively implement an SRCCY under the parameters of DOC 347. That proposal calls for renovations of 2 pods at the Vel Phillips Detention Center and new construction of a 40-bed facility at a project cost of $41.4 million and $14 million in annual operating costs. Making this plan operational would require a substantial increase in funding in Act 185 capital funds, as well as at least a $4 million annual increase in youth aids to cover Milwaukee's operational costs. As part of our research in developing our proposal, We identified the District of Columbia as a jurisdiction that went through a similar process of closing a large troubled juvenile correctional facility and replacing it with a secure residential facility called New Beginnings. New Beginnings was designed to house up to 60 youth in secure care. However, due to the success of community-based programming for youth in the District of Columbia and declining juvenile crime rates, there are only 7 youth currently placed at New Beginnings under the District of Columbia's Department of Youth Rehabilitation Services. Most of the facility has been repurposed to house youth being tried as adults and who are awaiting placement in federal correctional institutions. New Beginnings is an example of both a well-designed, secure residential facility and a system that opted for first-order change and that resulted in over-reliance on facilities rather than transformative change that emphasized community reinvestment and smaller home-like facilities coupled with successful community-based programs. Such an approach from the beginning would have prevented the overbuilding of a 60-bed facility. Consider the irony of the request within the grant proposal draft that was recently released to outline our plan to repurpose our new facility even before we have shovels in the ground. While we stand behind our proposal as it outlines all the elements necessary to implement Act 185, consistent with the current emergency rules under DOC 347, we also recognize that with some policy adjustments and a shift in our vision, Wisconsin can avoid similar mistakes and still maintain the urgency to close Lincoln Hills and Copper Lake schools. We'll skip ahead here a little bit. You have all of this, by the way, in a letter that we submitted to the community. So, looking ahead, other jurisdictions have done this successfully before us. The state of Missouri was the primary example informed by the Casey report, No Place for Kids, the case for reducing juvenile incarceration. Their efforts closed a 650-bed facility, 650-bed facility in Boonville, Missouri, and replaced it with 7 regional treatment-focused residential centers. In the year 2000, Wayne County, Michigan, Detroit, also began implementing a continuum of expanded alternatives to locked facilities for youth that resulted in the complete elimination of Wayne County youth in state youth correctional facilities and remarkable reductions in the number of youth in local secure care. Reports by the Center for Children's Law and Policy and the Columbia University Justice Lab have outlined the successes of Close to Home, the Close to Home initiative in New York City, at reducing secure care for youth and at the same time producing lower crime rates when compared to the rest of New York State. New York City had over 3,500 youth in secure care prior to 2010. Today they have 12 youth in secure care. That sounds unbelievable, but that is the case. With revisions to 347 allowing for a more home-like environment for the SRCCYs, Wisconsin could develop secure placement resources that more closely resemble the limited secure facilities that exist in New York City and Missouri. Such a change would allow the development of smaller, secure treatment settings through partnerships between counties, tribes, and local treatment providers. The system would be more responsive and adaptive to changes over time. It wouldn't be looking to repurpose large facilities, and it would allow for more local jurisdictions to have local small facilities. Only a small portion of the youth committed to restrictive custodial care are so assaulted that they require the type of internal security available within a detention center or correctional facility. Most can function successfully without such a restrictive setting, but require a secure building and/or perimeter to prevent them from posing a risk to the community while they receive treatment. We need to contain them, not confine them. With revisions to DOC 347, Milwaukee County could prepare to develop smaller, more home-like secure settings for the majority of youth and renovate 2 pods in the detention center to serve the youth in need of additional internal security and structure. We believe that such a plan could result in significant savings and reduce the overall institutional footprint while providing a more trauma-informed and engaging treatment environment for most youth. The history of failures of juvenile prisons spanning decades and across over 30 states, territories, and the District of Columbia, coupled with our own tragic and troubling experiences at Lincoln Hills and Copper Lake schools, more than justify the call for the closing of all youth prisons. To that end, the state should eliminate the Type 1 facilities and build regional secure residential programs in their place. The state would develop 2 regional secure residential centers to serve youth in a way that assures that no more youth are housed in them than absolutely necessary, and that trained staff will use proper engagement and de-escalation skills within an integrated treatment environment in lieu of chemical or physical restraints or punitive seclusion. If we aspire to establish a new, more therapeutic treatment culture in our youth justice system, we must understand that words matter. Elimination of the Type 1 category and the policy and practice expectations associated with it would be a step in the right direction. Similarly, the term serious juvenile offender or serious juvenile offender program is a legislative vestige of the super predator era. It serves no useful purpose, and its stigma only serves to interfere with rehabilitation and reform for our youth. There is no negative impact on community safety by eliminating the label and returning to the term extended supervision for youth who qualify under Chapter 938.34, paren 4, paren A. If we signal out a category of youth, give them a negative label, and place them in a separate and specialized environment, we are setting the stage for those youth to be treated more harshly. We must do everything within our power to assure that our history of abusive institutions does not repeat itself, and we must do this at this critical juncture. Finally, it's absolutely critical to establish a strong network of responsive and effective providers, mentors, coaches, employers, teachers, advocates, and others who look like our youth, come from similar backgrounds, and have similar life experiences. There are strong components of such a network already in existence in Milwaukee. Programs like Running Rebels work to do whatever it takes to assist a young person to be successful and to lead a healthy pro-social life. The Bakari Center is showing encouraging early results as it works to implement the integrated treatment model within its residential setting. Others also provide critical support and services to keep youth from penetrating more deeply into the justice system. Moreover, it is critical that we continue to expand the capacity for credible messengers, vocational training, alternative education, and recreational resources, and opportunities for socioeconomic advancement for underserved youth and families in Milwaukee and throughout our state. When implemented together, these changes could provide a robust representation of our desired future state of youth justice. We believe that these proposed changes will position our state to continue to pursue second-order transformative changes, and it's only through this pursuit that we can establish an effective, sustainable, and fiscally responsible youth justice system. Wisconsin should not waste this tremendous opportunity to redefine who we are as a state when it comes to youth justice. We look to your support and advocacy to help promote this vision.